So we can see there's a nice big area with a collection of fluid right over the elbow. So this is a bursitis, and it comes up usually. People usually think it comes out of nowhere, but usually it's from rubbing on the elbow, which just causes irritation. Big thing to look out for is redness and warmth. We don't see any of that, so this is an aseptic or no infection bursitis, and so it's been bothering our patient here, so we're just going to drain it. So we'll use a little iodine here. Last one, 3 times to be triple sure. First, just numb up an area, and what we do is we numb up an area on the distal side here, so that we can place our needle right along the long bone here, the ulna, and it goes into the elbow, so that there's no risk of hitting the bone. so we just go right along it.
No, I've had quite a few of those.
Yeah. I'm just going to create a little wheel here. Put in about a cc. Doing okay?
Yep.
Sorry about the burning. I know that
no
can
problem.
burn a little. There we go.
Dr. Mark Vaughn interrupting this procedure just before the best part to let you know that Dr. Gwaine Vaughn, who's doing this procedure, is a partner in the Auburn Medical Group. If you haven't seen him before and would like to see other videos with him, you can click the card here. As he goes on and does this procedure, it's going to be very interesting what we see. So I won't interrupt any further. Until next time, it's Dr. Mark Vaughn telling you to stay in good health. Now let's go on with the procedure.
It's numb. It's numb.
No pain?
No.
Okay, so a little bit of pressure. Yeah, went in nicely. We'll start to draw out. Well, we gotta just make sure we're in. There we go. Well, now I'm just getting a bunch of blood, which is interesting because usually this is a nice straw colored fluid. So the blood makes me think traumatic, like you may have bumped this against something and really done something. Not that you can think of, huh?
Well, like I said, when I was getting the radiation treatments,
Mm-hmm.
I was laying on my back on a metal table, and a couple of times I propped myself up on my elbows, and I felt something.
Okay.
That,
Get rid of that. Now what I'm going to do, just because this isn't that nice clear fluid that we usually get with a bursa, I will send that
okay.
to look at under the microscope. Make sure there's nothing weird going on there. So yeah, you can feel your elbow now, which is good.
Yeah.
Yeah, not much bogginess at all. We got just about all of it out. What we want to do is put a little pressure on there to try to make sure this doesn't reaccumulate. And you can usually take that off after about 24 hours. Okay. And then the biggest thing is to try to avoid the rubbing in the future. So, you can do that by various ways. One of them is to get like a donut pad and just kind of place it right on the elbow. And we talked a little bit about that. So, hope you enjoyed this, and we'll see you next time.